Imagine a world where a simple injection could melt away excess weight. Sounds like a dream, right? Well, the reality is more complex, and the World Health Organization, WHO, is stepping in to set the record straight about the use of GLP-1 medications like Ozempic for obesity. Forget quick fixes. The WHO's new guidelines, released in December 2025, emphasize that these drugs are just one piece of a much larger puzzle. These guidelines aren't just a suggestion. They're a call to action for how we approach obesity on a global scale. But here's where it gets controversial. Can a pill truly solve a problem rooted in societal and environmental factors? The WHO's first ever guidelines on glucagon-like peptide, 1, GLP-1, therapies arrive at a crucial moment, with these drugs skyrocketing in popularity worldwide. Why? Because they show promise in helping people manage their weight. The WHO now conditionally recommends these medications as part of a comprehensive strategy for treating obesity, recognizing it as a chronic, ongoing health condition. This signals a significant shift in how we understand and address weight management. Consider this. WHO statistics paint a stark picture, revealing that obesity contributed to a staggering 3.7 million deaths globally in 2024. And the problem is only projected to worsen, with the number of obese individuals expected to double by 2030. Faced with this growing crisis, member states turn to the WHO for guidance, prompting the development of these new GLP-1 medication guidelines. So what exactly are GLP-1 therapies? Think of them as helpers that work with your body to regulate blood sugar, promote weight loss, and reduce the risk of heart and kidney complications. Medications like liraglutide, Semaglutide, Ozempic is a brand name for Semaglutide, and Tirzepatide fall into this category. In September 2025, the WHO took an initial step by adding GLP-1 therapies to its essential medicines list for managing type 2 diabetes, particularly for individuals at high risk. Now, they're expanding the scope to include obesity treatment, marking a significant vote of confidence in their potential. Dr. Tedros Adhanom Ghebreyesus, the Director General of WHO, emphasizes a crucial point. Obesity is a long-term health issue that can be managed with ongoing care. While some treatments can help, they are not a cure-all. He stresses the importance of integrating these medications into a broader plan that incorporates healthy eating habits, regular physical activity, and consistent support from healthcare professionals. It's not just about the drug, it's about a holistic approach. Who are these GLP-1 therapies actually for? The WHO conditionally recommends them for long-term obesity treatment in adults, excluding pregnant women. And this is the part most people miss. The recommendation is conditional. Why? Because, as the WHO points out, there's still limited data on the long-term efficacy and safety of these drugs, how to maintain results after stopping them, their high cost, the lack of preparedness in healthcare systems, and potential fairness issues in who gets access. The WHO is very clear that if you're taking GLP-1 medications, you must commit to healthy lifestyle changes. This involves following a structured eating plan tailored to your needs and engaging in regular exercise. The combined approach, medication plus lifestyle changes, is key to achieving the best possible outcomes. The popularity of Ozempic, fueled by social media trends, highlights the public's desire for quick weight loss solutions. But Dr. Anish Nagpal, a bariatric surgeon, urges caution. Your body doesn't need such medicines if you are otherwise healthy. Young people should be cautious about using Ozempic just for looks without consulting a professional. Misusing it can lead to serious health problems, especially with the stomach and pancreas. This underscores the importance of responsible use and professional guidance. Medications like Ozempic should be viewed as tools within a larger health management plan, not replacements for fundamental lifestyle changes like a balanced diet and regular exercise. Think of it this way. The medication can help you get started, but your long-term health depends on building sustainable habits. The WHO reframes obesity as more than just an individual's problem. It's a societal issue that demands a multi-pronged strategy. Create healthier environments. This involves enacting policies that promote healthy choices and prevent obesity. Examples include taxes on sugary drinks, subsidies for healthy foods, and regulations on food marketing aimed at children. Protect high-risk individuals. This means improving screening programs and providing support to those at risk of developing obesity-related health problems. This could involve early intervention programs for children or targeted support for communities with limited access to healthy food options. Ensure lifelong care. This emphasizes the importance of ongoing, person-centered medical care. This includes access to doctors, dietitians, and other healthcare professionals who can provide guidance and support throughout a person's weight management journey. The WHO emphasizes that everyone should have fair access to GLP-1 therapies and that health systems must be prepared to use these medications effectively. However, current projections indicate that even with increased production, less than 10% of individuals who could benefit from GLP-1 therapies will have access to them by 2030. This disparity highlights the urgent need for global collaboration to expand access and address issues of affordability and equity. This raises a critical question. Is obesity primarily an individual responsibility, or is it a societal problem demanding systemic change? The WHO clearly leans towards the latter, advocating for a comprehensive approach that addresses environmental, social, and economic factors. What do you think? Should access to medications like Ozempic be universally available, or should they be reserved for specific cases? How can we create healthier environments that prevent obesity in the first place? Share your thoughts and join the conversation in the comments below.